I guess you know what's next, right? Yes, today I'm going to show you how to pass your intramuscular injection station. Hello nurses, hello world, this is Nurse Cecile and welcome back to my channel. This video is solely for demonstration purposes as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden Manual of Clinical Nursing Procedure 10th edition. All information presented are public domain materials accessible through the relevant governing organizations' websites. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 Test of Competence or the OSCE examination. This can be a helpful material for overseas or internationally trained nurses to learn and adapt to the UK clinical settings and transition effectively into practice. In the NMC OSCE station, candidate needs to demonstrate injection skills, whether subcutaneous or intramuscular. And as I've said a while ago, today I'm going to show you how to do intramuscular injection. You have to do this station within 12 minutes. Nurses, ensure that you have to safely administer the medication. And since it's administering medication, like I always say, again and again, you have to remember your 5 R's or the 5 rights of the patient to medication. These are right patient, right medication, right route, right time, and right dose. This should include the checking of the prescription against the patient's wristband. Also, when giving medication, documentation is vital. This chart should be dated, timed, and signed. If any of the aforementioned is missed, this should result into a fail. So, we don't want that, nurses, do we? But before we get into it, please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more videos, then hit the notification bell. Oh yeah, comment down below what other OSCE videos you want me to do. Alright, are you ready, nurses? Let's go! Now for the most favorite part of this video, and that is the simulation. So I'm gonna go now to the patient and do the procedure. First, I'm gonna gel my hands. 5 backward and forward stroke, palm to palm, right palm over the left dorsum, vice versa. Fingers interlace, back of the fingers interlock. Rotation rubbing of the thumb, rotation rubbing of finger clasp, and rotation rubbing of the wrist. Let it dry for 30 seconds. Now I'm ready to converse with my patient. Hi, good morning. I'm Nurse Cecile and I'm going to be your nurse for today.
Hi, good morning.
How are you?
I'm good.
You're good. Okay, good. So you probably wonder why I'm here. So I'm here because you are due for your IM injection, your intramuscular injection, which is your hydroxycobalamin. That is, by the way, your vitamin B12. Are you happy to take it?
Yeah.
Okay, so before we get into it, would it be okay if I just do an identification check?
Yeah, sure.
Okay, can you please tell me your full name, please?
Sarah G.
And your date of birth?
2nd of the 3rd, 1987.
Okay, 2nd of the 3rd, 1987. And your address, please?
999 Edinburgh Avenue, NR 317HA.
Okay, I got the correct patient according to the prescription. So can I just ask, are you allergic to any medication, food, or latex?
I'm allergic to warfarin.
Warfarin, okay. And what kind of allergic reaction do you get from that?
I get rashes.
Rashes, okay. According to your prescription, here it's that you're allergic to warfarin and the reaction is rashes. So again, I got the correct prescription. I got the correct patient, okay. Also, are you comfortable sitting there? Do you want me to reposition you at all?
No, I'm okay.
Do you have any pain at all?
Yeah, just mild headache.
So it's a headache, yeah?
Yeah.
Mild headache. So from 0 to 10, 0 being no pain and 10 being the worst, can you rate your pain?
Around 2.
2? So it's very mild. Yeah, would you want some pain relief though?
No, I'm okay.
Are you sure?
Yeah.
Okay, do you want me to still proceed with this one?
Yeah.
Okay, cool. I'm just gonna need to prepare the medication. So in the meantime, if you need me, just give me a shout, okay?
Alright.
Okay, thank you so much. Before removing myself to the scene, then let it dry for 30 seconds. So I'm gonna prepare now the medication. the equipment that I needed. So before preparing the articles that we needed, I need to do the hand washing, okay? So I'm gonna wet my hands. Get some soap. With 5 backward and forward stroke from palm to palm. Right palm over the left torso and vice versa. Fingers interlaced. Fingers interlocked. Rotational rubbing of the thumb and vice versa. Rotational rubbing of your finger clasp and rotational rubbing of the wrist. Rinse it thoroughly with water and then pat it dry with clean towels. Dispose it in the domestic bin. Pat it dry. And again, there you go. That's how you wash your hands using the 6 steps of hand washing according to the World Health Organization. So the first thing I'm going to do is to read the prescription, okay? So I get here, you are visiting a new patient at home who requires medication, hydroxycobalamin injection. All the equipment you need is provided. Please administer the medication using the prescription below. It is today and the time is 8. So the prescription says patient details. The name is Miss Sarah G. Address is 999 Edinburgh Avenue, NR 317HA. Date of birth is 2nd of the 3rd, 1987. So she's allergic to warfarin and the reaction is rashes. So I got hydroxycobalamin injection, vitamin B12, 1 milligram in 1 meal, intramuscular once a week. Name of the signature of the doctor, Dr. Jean Gray, and the date is today. So I can state now that this prescription is legible. So I'm gonna prepare now the equipments that I need. Miss Examiner, are we going to use a disposable tray?
Yes, you will use a disposable tray.
Okay, so I got here now the disposable tray as confirmed by the examiner. So the next one I'm gonna get is the medication itself, the hydroxycobalamin. So I got here hydroxycobalamin injection or vitamin B12. Expiration date is 5th of 2029. Yeah, so it's the same. I compare it against the prescription. I can attest that this is the medication that I needed. So it's clear and there's no particulate matter, so I'm gonna take it. Put it on my tray. The next one would be, since according to the prescription, I am just gonna give 1 milligram in 1 meal. So I believe I can just get the 2 meal syringe, okay? So again, clean and intact. Expiration date 5th of 2026. So I'm gonna put it on my tray. Next one is, I got the filter needle, clean and intact. Expiration date is 5/5, 2026. So now I get the safety needle, which is clean and intact. Expiration date is 11th of 2026. I'm gonna get Clinel swab, which is 70% alcohol. I have got the expiration of 9/2024, clean and intact, 2 of them, 9/2024. And lastly, if it is provided or if it is available in your exam, so make sure you take it, okay? I just get here a small plaster, all right? Next is the gloves. I'm gonna prepare now the medication first before going to the patient. So let me just wear my apron. Okay, gel my hands. Let it dry for 30 seconds. So let me just wear the gloves. Now is to get the ampule. Okay, I got here hydroxycobalamin injection, vitamin B12. Checking it against the prescription, it's the same. Okay, so now I'm gonna tap the neck. I'm going to tap the neck, making sure that all of the solution are at the bottom of the ampule. So now I'm gonna get the alcohol swab. Okay, open it. Make sure you open the swab. Clean it for 30 seconds. Now, use the swab to snap it open. There you go. Assuming that this is a glass, which is an ampule, this goes to the sharps bin. Now, this one is on the clinical waste bin. Okay. Like I said a while ago, since it's a glass, inspect if there is any glass fragments at the bottom, if applicable only, yeah. So I can see that there's none, and I got the whole one disposed in the sharps bin, okay? So let it dry for 30 seconds. So I'm gonna put it on the tray. Open the article. So I get the syringe right here. So let me get the... Attach the filter needle to the syringe, making sure not to touch the key parts, okay? Again, do not touch the key parts. This is the key parts, okay? Now, I need to withdraw the required solution. So 1 milligram in 1 ml, I just need 1 ml. So right here. So I have withdrawn 1 ml. There you go. And I need to recap this one or resheath the needle with the 1 scoop technique according to the Royal Marsden, okay? And that's how you do it, okay? Make sure you verbalize that as well, okay? Now I'm gonna put this one inside the tray. Tap syringe to expel air bubbles. I'll get now the safety needle. Remove the filter needle and then attach the safety needle into the syringe. Making sure not to touch the key parts. Okay? So I get here now my medication. And straight away, I'm gonna dispose the sharps into the sharps bin. So let me just dispose the non-sharps into the clinical waste bin. Okay. In the hospital setting, I'm gonna need this one to be double checked by another registered nurse. Okay? Miss Examiner, do you wanna recheck this one?
No need, nurse.
Okay, so since we are in the community setting, the examiner or the assessor will tell you from the beginning that double checking may not be necessary in the community setting, okay? So again, 1 meal, okay? I'm gonna put it back in the tray. Now I'm gonna remove my gloves. So gel my hands. And let it dry for 30 seconds. I am now gonna get another pair of gloves. Okay, take the tray to the patient. Gel my hands. And then let it dry for 30 seconds. So I'm going to apply now the gloves. Making sure that privacy and dignity is maintained. So I am gonna close the door, windows, or the curtains, okay? Hi again. Oh, by the way, what do you want me to call you?
Just call me Sarah.
Sarah, okay, Sarah. Would it be okay before we proceed with this medication? Can I please just recheck your ID again?
Yeah, sure.
Can you please tell me your full name, please?
Sarah G.
Sarah G, and your date of birth?
2nd of the 3rd, 1987.
Okay, 2nd of the 3rd, 1987. And your address, please?
999 Edinburgh Avenue, NR 317HA.
Okay, so do you have any allergies to food, medication, or latex?
Allergic to warfarin.
And the reaction is?
Rashes.
Rashes. So I can confirm that I get the same patient, okay, according to the prescription. Alright, Sarah, this is an intramuscular injection. Have you had this before, vitamin B12?
No, this is my first time.
This is your first time. Don't worry. So where do you want me to inject this one? You can have it on your arm or your vastus lateralis. Okay, this is the middle third of the outer portion of your thigh, or the rectus femoris. This is now the middle third front of your thigh. So where do you want me to give you the injection?
I want it in my arm, please.
Okay, which arm do you want me to give it?
On my left one.
Left one, okay. Alright, in this procedure, I need you to be in an upright position, please. Okay. Oh yeah, by the way, before I do this, do you have any pain now?
I'm not in pain at the moment.
Okay, please confirm from 0 to 10, 0 being no pain and 10 being the worst. Did you say no pain, which is 0?
0, yeah.
Okay, sure. Okay, so good. That's good. So would it be okay if I just expose your arm?
Yeah.
Okay. Expose your arm. Okay. As I am assessing the injection site, I can see that there is no signs of inflammation, edema, infection, rashes, and skin lesion. Okay, so I'm ready to proceed. Since I am using a hard mannequin right here, I'm just gonna do all the injection on this smooth sponge. Okay. So the first thing I'm gonna do is to clean the injection site with the alcohol swab, okay? So I'm just gonna put this one at the side of my tray. Open the swab. So yeah, I'm gonna clean it from inner to outer. And then let it dry for 30 seconds. Now I'm gonna dispose this in the clinical waste bin. Okay, let's open this one first. There you go. Now, okay, again, I'm gonna use my non-dominant hand to do a skin taut. I'm gonna need to stretch it, okay? Here you go. Stretching it. So that's a skin taut. Actually stretching it. There you go. And make sure nurses do not let go of this one until the giving of the medication or the medication administration is finished, okay? So you're gonna have to leave your hand over there for a while, okay? Hold the syringe like a dart, okay, in a 90-degree angle. Inform the patient. Sarah, I'm gonna give you now the medication. Sharp scratch.
All right.
Insert the needle at a 90-degree angle. Leave 1 centimeter of the needle exposed like that, okay? And then I'm gonna depress now the plunger. Depressing the plunger, okay? 1 mil every 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. I'm gonna leave the syringe there for the next 10 seconds for the medication to be diffused to the tissue, okay? 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, and then I will rapidly remove or withdraw the needle, okay? Okay, then I'm gonna remove now the skin taunting, okay? That's the time where you're gonna remove your skin taut, okay? And apply now the safety mechanism. There you go. Now I'm gonna dispose it into the sharps bin, okay? And I'm gonna get the small plaster here. And apply a gentle pressure, just a gentle pressure on top of the injection site. Okay. Make sure to advise the patient not to massage the area to prevent the risk of tissue damage, okay? Okay, Sarah, please make sure to not massage the area, okay? Otherwise, it's gonna be a risk for tissue damage, okay?
All right.
Okay. Okay, there you go. So I'm gonna pull down the sleeves. There you go. Are you all right, Sarah?
Yes, I'm okay.
Okay, let me just remove all all this, okay? And then document if that's all right with you, yeah?
All right.
Are you comfortable with that?
I am comfortable.
Okay, let me just dispose everything that I've used. Hands. and let it dry for 30 seconds. So as you've noticed, I happen to leave the ampule on the tray for a minute, okay? Because I just need that for the batch number. Okay, so as you have noticed, I depress the plunger and slowly administer the medication. So as you've noticed, I did not withdraw the plunger. You will only do that if you're administering an intramuscular injection on the dorsogluteal of the patient. So at the moment, it's only on the patient's arm, so no need to withdraw the plunger, okay? Take that note, nurses, okay? If you're maybe questioning why do we have to withdraw the plunger, so this is just to check if there is any blood aspiration, okay? Now I'm gonna document.
So today is 8, so signature. Date is 1st. Time is 8.
Since I have finished documenting, I'm gonna dispose the medication or the leftover ampule to the sharps bin. Okay? And then the disposable tray into the clinical waste bin. Okay? Instead, I'm gonna gel my hands again. And then let it dry for 30 seconds. Sarah, we are finished now with the safe administration of medication, which is your hydroxycobalamin, which is your vitamin B12. I have finished the documentation. Alright, since I have provided the privacy and dignity of the patient, I'm gonna remove now I'm gonna withdraw back the curtains, open the door and the windows, okay? Are you comfortable right now?
Yes, nurse.
Okay, so I'll still be with you for the next 15 minutes just to check if there is any adverse reaction, okay? Because I have given you a medication. But if I'm not here anymore, please do contact your GP or your district nurse or your community nurse if you have any queries. Also, if there's any emergency, then call 999, okay?
Alright, thank you.
Okay, so like I said, I'll still be here for the next 15 minutes. If you need me, just give me a shout, okay?
Okay.
Thank you so much for today.
Thank you.
Thank you. Let me just gel my hands again. Also, after this procedure, I need to verbalize that I am going to wash my hands using the 6 steps of hand washing. And just like that, we are now finished with our intramuscular injection station. So, I hope you learned something for today, and if you like this video, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post new videos, then hit the notification bell. Oh yeah, comment down below if you like this video or what you don't like about this video. Also, what other OSCE videos you want me to do next. This has been Nurse Cecile. See you on the next one. Bye!
Good morning.